Well, good evening. How's everyone doing? Good. I'm Randy Kaysen, Senior Administrator for the hospital, and welcome to our fall series of town hall meetings. We've been meeting all week, having great attendance, great feedback, both on the information I'm giving, also a lot of good questions and answers that we've been able to share as well. Really quickly, is there anybody here this is your first town hall meeting? You've only joined the organization in the last 3 months. Yeah, guess we have some small hometown crew here. So welcome to all of you. We're going to spend some time together. I am now formally committing to about 30 minutes and practiced for the first 3 or 4 town halls, and it worked out very well. And so we're going to look to try to really increase the number at the next series, next time, to make it really much more available for all of our associates. This is our agenda. After our opening prayer, we'll have some celebrations. We're really focusing on some of that, and one of our celebrations is a good catch out of the labor and delivery area. So you'll know the story probably already. I'll share that, and also some celebrations that we're able to share with you as well. I'll give you an overview of our leadership briefing. You actually got an email today from Jeff Korsmo discussing a lot of the work we've been doing regarding our financial position for the organizations and things we're wanting to do to make sure we have our organization ready to financially succeed in the future, as well as providing high quality service and safety for our patients. So I'll talk more about that shortly. And then from there, it's the open forum. The most important part of our town hall is just making sure we have good time to have dialogue, questions and answers, things I talked about, things I maybe did not mention if you have a question about. This is our opening prayer. I will start the prayer, and I just ask you to join me in it. Father God, we thank you for the privilege of assisting others by our tasks. Our service is a prayer to you. May our spirit of service be ever deepened by our desire to be more fully aware of the many gifted people who surround us each day: associates, patients, residents, friends, and family members. Amen. All right. Thank you for joining me in that. All right, a few celebrations. First of all, talking about the Mount Carmel Foundation, you were each given a slip of paper. We had a great success with about 18% of our staff joining the Mount Carmel Foundation effort, and basically pledged over $20,000. What we've been doing this week is giving all of you one more chance to become a part of it. And it wasn't so much about the number of dollars we're raising. We're just wanting to get more people engaged with it. So what we've been talking about all week is just the opportunity, if you were to just give $1 a pay period. And it's not about how much money you raise individually, it's what can we do collectively. If you give $1 pay period, that would be $26 in a year. And if we hit the target we're looking for, we're trying to get up to 50% participation of all of our associates. If we do that, this week we would raise $5,460 this week. And what we would be able to do with that, we would be able to basically purchase 2 new blood pressure or vital signs monitors for the patient floor. So that's what our goal is. All right, some of our good news. This was a good catch. And really quickly, I've been sharing this story all week with all of your fellow associates. There was a heart murmur on a newborn, was noted by Taylor Cedeno, and I think Taylor has been here since maybe about May. And so she's not a totally new nurse, but she's new to us since about May. I think she worked in Northwest Arkansas for a couple of years before she came here. The heart murmur was confirmed by Hillary McCall, and the care of the newborn was continued by Linda Beck. Their impressions and their critical thinking and skills those ideas were shared with the physician, and the physician ended up transferring the patient to a higher level of care, where I believe the newborn had an angiography. I think they had to be opened up. But this was just what we call a great catch. We have shared this all week, so that's just a great testament to when nurses, when you have something going on and when something just doesn't feel right, I encourage you to use those critical thinking skills and just make sure you share that with the doctor, because here in this situation, could have possibly saved this newborn's life. So it's a great catch. Also, congratulations to our radiology department. What we are sharing here, basically every modality of our radiology department, including ultrasound, that most recently got their American College of Radiology accreditation. They got it the other day. Also, the newest information, CT and MRI, last Friday received their accreditation. So therefore, our entire radiology department is accredited, and that is the exception, not the rule with hospitals. We basically did some research throughout all of Southeast Kansas, Southwest Missouri, and we were the only hospital that had every one of our modalities in radiology accredited. So that's just a great testament to the hard work of our staff there. It takes a lot of work to do that. Sue Lutz is our manager of respiratory and sleep lab, and she is the October Associate of the Month, so we've been celebrating Sue. Teresa Franklin is the Excellence in Rehab Award winner for 2015, so we've been celebrating Teresa. She does a great job, and she's been a finalist in that award for several years, and she won it this year. Also, fourth floor opened this past week. So thanks to all of you who took an active role in helping to move our patients over to fourth floor. It was a lot of work, a lot of preparation that needed to get done in order to get that floor ready, and now we're fully into it. So probably the majority of our patients on any given day will be on that one floor. Congratulations to the following new leaders. There were leader transitions. Nancy Tyler is now our manager of both medical and surgical, so she's over the entire fourth floor area. Kristen Spicer is our new manager of ICU, cardiac step down, and rehab. So Kristen, who probably all of you know, especially she worked a lot of nights and weekends as a house supervisor. She's now the manager on the fifth floor units, also rehab. Cheryl Craig is now the director of all of our patient care services, so she's over all of our inpatient bed areas. Carrie Amershek, who has been the director of quality and risk management, is now also going to be directing our care management department. So we added that area in. And we'll talk about some of these transitions. You know that Amy Wren, our current Director of Medical Services, is going to be transferring to Wichita to a new position there. And also the former Director of Care Management, Christy Thornburg, her and her husband moved to Kansas City. So some of those transitions is something I'm going to be talking about shortly, of how we're looking at our management processes and how we evaluate the span of control for our leaders. And I'll talk a little bit more about that shortly. Hospital updates. You got an email today from Jeff Kordsmo talking about this. So basically, I'm giving you a summary of that email. And it's basically the topic was Mission Advancing Performance Update. We looked up after the month of August, and we found that our performance as an organization financially had us about $9 million behind budget. So not a great position to be in. And we looked at, and where did this all come from? I mean, basically, we know that today we're getting reimbursed less for Medicare patients and for Medicaid patients than we did last year. And we know that next year we're going to take more cuts in Medicare reimbursement. It's just that we know it's a reality. And so we're going to have to make sure that we are always finding more efficient, high quality, safe ways to provide the care, but we're going to have to find more efficient ways to do it. So all of those challenges have us really, after the month of August, having to look and say, what do we need to do to really make sure that we maintain our ministry at the highest level, both in patient care, quality, service, and safety, but also being financially able to sustain our mission going forward. So we started implementing an improvement plan to make sure that we sustain this going forward. And there's four main areas that we are focusing on. The first is workforce management, and that is just what it talks about. It talks about 40% of the total budget of any hospital, and same thing for ours, is the staffing. And that's the largest part of our work. And we have been basically kind of refocusing our efforts to make sure that we perform according to budget. We budget a certain number of staff to take care of our patients, and we just want to make sure that we are meeting those budgeted expectations. And we did improve in the month of September by about 170 FTEs simply by meeting our budgeted staffing. So we cheated up a little bit more. And when I talk about all these numbers, I'm talking about for all of Via Christi, both our hospital here in Pittsburgh, our hospital in Manhattan, and then we have 5 more hospitals in the Wichita area as well. We reviewed all of our open job postings. We had 410 total openings throughout our organization, and 200 of those they remain open. There were the direct patient care areas, nursing assistants, and all of those that have direct patient care impact, and those remain open, and we will continue to recruit for those. We did eliminate 95 positions throughout the whole organization. 75 of those were vacant. I want to give you two examples. Those two that I talked about earlier in terms of leadership. When Amy Wren moved to her new position in Wichita, we did not fill Amy Wren's position. Cheryl Craig absorbed the medical directorship into her role. Secondly, when Christy Thornburg, who is our Director of Care Management, moved to Kansas City, we chose to have Carrie Emershek absorb those roles into her leadership. So that's two of those that did not get filled. That's how we're doing that. We will also restructure orientation. This is really an organization-wide comment. We are restructuring nursing orientation, and what we found that, especially in the Wichita area, it maybe took 4 to 6 weeks before our new nurse orientees were getting onto the floor to be proctored by a mentor nurse. We are looking at best practices of how other organizations are orienting their nurses and see if we can maybe fast track that a little bit better. We do a pretty good job here. In fact, Wichita actually looked at the way we do some of our orientation and tried to emulate some of the things we're doing. And then lastly, similar to what I talked about earlier, we're just looking at our management structures to make sure that we are efficiently managing the organization and having what we call a span of control that fits to the staff, to the number of leaders that we have as well. A second area is clinical resource management. And that's just making sure that we are instilling best practices, that we don't have variance in the way we care for one patient versus another, one physician versus another, making sure we have a good standard of care throughout all of those. And what we found is we think we have an opportunity, if you see right here, we think we can save as an organization, total system, $7.2 million a year simply by eliminating the variance in the care from one physician to another or one patient to another. So we're going to work on that as well. Also, we found some opportunities where we are providing a lot of testing on the last day of admission. So a CT or an MRI exam that is done on the last day of admission. So we'll have that CT or that MRI study done. The patient may actually go home before the result is even received. So really that result really had no impact on that patient's acute care stay. And another example would be an endoscopy done, screening endoscopy done on the last day or 2 days before a patient goes home. That really has no impact on this patient's care while they're here. So we just found that there were a lot of those opportunities to improve in that area as well. When we're taking care of a Medicare patient, we do not get additional reimbursement for those types of tests. If they were to go out of the hospital and then come back to their physician and get that ordered on an outpatient basis, we would actually be able to receive reimbursement for that. Programs and services, our goal there is to improve the clinical integration and care coordination among all of our areas. We believe that we have some opportunities there as well. And lastly, revenue cycle management. That's basically focusing on our ability to code, bill, and collect for the services that we provide. We know, me personally, I know that one of my family members had some care provided at our hospital, but we didn't receive a bill for about 6 months. Well, we know that we have opportunities to do better in that area with our revenue cycle to make sure that we appropriately get reimbursed for the care that we provide. So we're going to work on that as well. Again, you're going to see an email in your box, so you can look at that, and you'll basically see the same information there. And that was from Jeff Kordsma. This is our key performance indicators, kind of what we call our stoplight report. Reminder. Green is good, yellow means we're close to our target, not quite hitting it, and red means we're not hitting our target. And this is how we're doing as of the end of September of 2015, so the most recent month. First of all, hand hygiene, our goal is 99%. Basically, 100% of the time we want to be foaming in, foaming out between every patient interaction. Every time we go into the room, we're doing a very good job there, 99%. Flow and throughput, our goal is we only want to have 18.9% avoidable days, those longer lengths of stay, those days above what is expected. We're currently at 19.1. We're almost there. We're just almost hitting that target, but not quite. So we're doing very good there. And this is actually green. So we had updated it. This is actually now 74.8. We're actually green on patient satisfaction. And just a quick reminder, our goal, 74.1% of the time, we want our patients to give us a score of a 9 or a 10 out of 10 on the question, overall, how would you rate your patient care experience? Okay? We ask that question, overall, how would you rate your patient care experience for this event, for this stay? They can give us a 0, they can give us a 10. And what we do, we count the number of 9s and 10s. And we want that to be 74% of those surveyed would give us a 74.1 to give us a 9 or a 10 out of 10. We're currently, actually this is updated to 74.8. So we're actually hitting that. That is actually green. So great job there. Financial performance, we are ahead of budget. We actually we were behind budget, as I said earlier, after August, but we had a very positive September, and we were able to catch up that gap, and we're actually ahead of budget, so we're green for financial performance. Growth, we're actually hitting our growth targets as well for so far this year. That's both on inpatient and outpatient volume. And then lastly, patient safety, something you should be very proud of. You know that we've been focusing a lot on patient falls and reducing patient falls over the last 2 years. In my 5.5, almost 6 years of being with Via Christi Pittsburgh, this is the first time I've ever seen us under 4 falls per 1,000 patient days. We're actually at 3.9. Quick reminder, how long? It takes us about 20 days to have 1,000 patient days. That's averaging 50 patients a day. Takes us 20 days to add up to 1,000 patient days. Therefore, we would want to have no more than 4 falls during that 20-day period. And we're currently averaging 3.9, so that's a very good number. What you should really be proud of, that it's been more than 2.5 years since we have had a patient fall with injury. So that's really good. Even when we have a patient fall, what we're having is we're assisting them to the floor. They're not being injured. And that is what is really exceptional about the care we've been given over the last 2.5 years. No patient falls with injury. And we know that if a patient falls, 80-year-old falls and out of the bed, fractures the hip, the prognosis is not good. I mean, odds are no one dies from a fractured hip. They die from pneumonia because they're laying in bed because they cannot ambulate, they cannot walk anymore, and fluid sets up and then they get the infection. So we're keeping our patients much safer by our intense focus on eliminating falls. So we've done a great job there as well. New physicians. We have Dr. Jessalyn Humble, who started this week. So I'm not sure if y'all seen her yet up on in the newborn nursery, but she literally started Monday, and we are having her welcome Thursday at 2 p.m. in the cafeteria. So she started this week. Dr. Erin McNulty started August of 2015. You may have already seen Dr. McNulty on the floor already. Dr. Chad Stewart is one of our new family practice physicians that will be starting in September of 2016. So he's got about almost another 11 months before he gets to start. Dr. Titus Weller is signed to come on in September of 2017. So he signed 2 years in advance. And so he will be here in September 2017. These are 2 new family practice physicians who are coming to Pittsburgh. Also, Dr. Jackie Eutzis is coming. She is a family practice. However, her specialty is she's specializing in skin disorders or dermatology. So her exclusive practice is going to be in the area of dermatology. So as you know, we do not have a dermatologist in Pittsburgh. So she's going to have, I believe, a very successful practice here. She'll be able to serve the entire region. So we're excited about that. We're also interviewing a interventional cardiologist and nephrology husband and wife team. The cardiologist, Dr. Khalid, is actually here this week. He's actually here working with Drs. Margie and Dr. Hamad and done quite a few procedures. So we're actually having him here this week, and we're hoping to have he and his wife hopefully come back for a formal visit for her. She has not been here before. He's been here a couple of times though.